Hi, everybody. It's Fran here at Dr. Gashinsky's Holistic Dental Center for the next installment of our webinar series. Hope you've been enjoying them so far. We love having you join us. We hope you're learning a lot, and we hope you can learn more tonight. I'm Fran, your holistic hygienist. I also do a few other things. I'm a speaker, writer, et cetera, and I'm going to moderate the webinar tonight. I won't be speaking much. We have two amazing guests. We have, of course, Dr. Vladimir Gashinsky talking about a topic that you may say, what does that have to do with teeth? And then we also have a guest speaker who is going to just blow your socks off. All right. With our webinar series, and we're going to be talking about inflammation. And we're going to be talking about fighting inflammation the holistic way. So what do we mean by that? Well, you have to listen in, stay tuned, and we're going to talk to you a little bit more about that. You'll be surprised the correlation between how your mouth and your body can be affected by inflammation. So first, we have Dr. Vladimir Gashinsky. I'm just going to tell you a little about who he is. He is not only an accredited member of the IAUMT, he is also SMART certified, which means that he is certified to do safe mercury removal. He follows very strict protocols set forth by the IAOMT, which is the International Academy of Oral Medicine and Toxicology. He is also the owner and CEO of the Holistic Dental Center in Millburn, New Jersey, and is the president of the first Holistic Chamber of Commerce in the state of New Jersey. He's been practicing holistic dentistry for over 20 years, and he's thrilled to be able to share with you how the mouth and the body are connected. Yeah, actually, believe it or not, your mouth is connected to your body, and how inflammation can affect you. Now, with our special guest, we have Dr. Gero, who is a naturopath, and he's practicing out of Clifton, New Jersey. He's not only a naturopathic physician, he is also a board-certified doctor of nutrition, registered herbalist, medical exercise specialist, and he's also a member of the postgraduate association at Harvard Medical School. So when I tell you get a well-rounded ability to get the most information possible from the panelists you have, you're getting lots of bang for your buck. So that being said, we want you to ask lots of questions. We are on Facebook Live. Also, make sure you catch us, whether it be here on Facebook Live, tell your friends, go to Dr. Vladimir Gashinsky's Facebook page. You can ask questions there. You can ask questions here. We are going to save a lot of the questions to the end because we have so much information to get into that we want to make sure we get it all to you. So please just send them in, and then we'll get to them when we can at the end. But make sure, catch us on Facebook Live or here on the internet. Another thing, you want to listen to the end because we have a special thing for you guys. For those who listen to the end, and at that time, make sure you get your pen and paper ready because we're going to have something that you're going to want to write down, okay? So that being said, let's get to it. So, Dr. Gero, I'm going to ask you first. Since you're the guest speaker, I'm going to start with the guests. That's how you treat your friends when they come to the house, right? You take care of the guests first. So I'm going to ask you, what is actually inflammation?
Well, first of all, I want to explain what a naturopathic doctor is because most people may not be aware of what a naturopathic doctor does. First of all, I consider myself a physiological detective. So people want to know what's going on with them and what they need to do. However, what I'm looking at is the causal factors that actually create, and in this case, inflammation. So it's not a matter of just treating inflammation, it's trying to uncover the reasons why we're having inflammation. And basically, what is inflammation? It's the body's natural defense system. And it's produced in response to an injury, to an infection in the body, to some type of foreign invader. And it's the body's intention to defend itself against parasites, viruses, and it wants to detoxify. And it, in essence, wants to facilitate healing within the body.
Very good. And I know with inflammation, you can have like if I ran into the door, I bang my elbow, I can get some inflammation there, and then if I didn't take care of it, it can turn into something worse. If you could just let me know a little bit more about what that is, maybe our listeners need to know more about that.
Well, inflammation can either be acute or it could be chronic. And an acute inflammation begins within seconds, but it could actually manifest itself up to 72 hours after after an injury, because you can be involved in a sport activity. You could injure yourself, and because of the adrenaline response during that event, you may not feel it for a day or two, or maybe even 3 days. That is an acute injury, and usually that injury may last anywhere from a day to possibly up to 3 months.
Right. And then, I'm sorry, Dr. G, in the dental aspect, an acute injury would be something like, what would be an acute problem in the dental field?
You just cut the gums in your mouth. You're just eating something sharp. This is acute injury. You just hit something hard on your teeth during sports activity. It's acute injury. And this is, we don't see too often, acute injury in the dental field. Mostly we're dealing with chronic inflammation. They just last for years and just really, really affect your body.
So Dr. Gero, I'm going to have you take that over. Chronic inflammation. That seems to be a big problem with a lot of people.
Well, it sure is. And chronic inflammation actually is that type of inflammation that has lasted for 3 months or longer, and it could last for years or even a lifetime. And these are the types of inflammations that are really contributed towards a myriad of diseases, including cancer and arthritis and autoimmune diseases and diabetes. All of these are factors that may be precipitated by an initial inflammation that you're constantly fueling, you're constantly infiltrating. So if you don't do something that's going to tame the heat, tame that inflammation, the inflammation is going to proliferate.
Now, you're going to always feel the inflammation? Like, when I think inflammation, I think of pain all the time. Does it necessarily be something that's pain? Do we always know that we have inflammation?
Well, let's think about diabetes. Diabetes is really an inflammatory cascade. Now, there's no pain necessarily associated with diabetes. It's actually considered a silent killer. High blood pressure is a silent killer. So high blood pressure is certainly inflammation within the arterial vessels. Mm-hmm. So somebody that's walking around with a blood pressure of 180 over 110 is going to experience inflammation, and there's no pain associated with that, but it's fire. It's fire within the blood vessels. So when somebody's walking around with that, it's certainly inflammation, even though there's no pain involved.
Right. And then I know in the dental field, Dr. G, people can have inflammation and they don't even know it also.
Yeah, definitely. A patient coming in and have just a little bit bleeding in the gums, but this is inflammation going into the gums. We call it a gum disease. And the gum disease really, really fire there at the beginning. And after that, it starts spread. And gum disease is connected to a lot of chronic conditions, like Dr. Gero mentioned, the high blood pressure, diabetes, and much more. And we're going to talk about it a little bit more, and just going to facilitate a little bit more about these problems.
Yeah, exactly. So now that we've talked about what inflammation is, now inflammation can cause lots of problems. And as we can see by this graph, that it looks like inflammation is responsible for at least 7 out of the top 10 leading causes of death in the United States. That's pretty alarming, isn't it?
Yes. And this is very, very important for us as a clinician. Explain to our patient how important to deal with inflammation as soon as possible. And really start to prevent all these problems that are connected with the inflammation that's possible to control today, now. Don't wait until it's really just going to hurt you badly.
Right. And that's the whole thing, is like Dr. Gero was saying earlier, finding the cause. We need to find out what is creating the inflammation in our body. So, that goes to our next question is, what is the cause of inflammation? So Dr. Gero, you want to pick that up?
Sure. I actually highlighted about 13 different causes, and there's a myriad of different ones that are actually causal factors. And we start with microbial infections. And one of the things that really impresses me about what the Holistic Dental Center does, and what makes your center unique, is that you're taking a swab of somebody's gum and you're putting it on a slide, and people can actually see on a 32-inch screen what's going on in their mouth, what's crawling around. And you don't think of that as inflammation necessarily, because it's not pain, but it's certainly those microorganisms that if it's in your mouth, it's in your intestines, it's in your body, and those things, if you don't know that it's existing, it's going to proliferate. It's going to proliferate. It's going to become a very serious chronic issue that's going to cause many, many problems. So that's one of the things that really impresses me about what your center does, that nobody else does that I know of. But other things that are contributory towards chronic inflammation, things like surgery, scar tissue, physical agents like trauma, injury, radiation, burns, frostbite, vaccinations. It's amazing how much damage sometimes a vaccination may cause with somebody that's susceptible to it. Chemicals, household cleansers, and industrial pollutants, hypertension, hormone therapies, tobacco, excessive sugar, and foods that you're eating that are really inappropriate for you.
And then pesticides also. All the pesticides and toxic chemicals that are put in our foods and in our water and in our air. It's crazy.
Right. Exactly.
This is the most missing part, that what air we breathing, what water we drinking, what food we eating. Because that unfortunately, that only just recently people start paying attention. That's why just people are going and just trying to eat better quality food, and they're putting better filtration, and they're really thinking about what's going on now. Because it's very, very important, because this is a fuel for your body.
Right. That is very, very true. A lot of people, years ago, we'd always, there was this whole thing with the TV dinners. They would have, when was that, back in the 50s? Everybody had the TV dinners and the prepackaged meals, and just stick the kids in front of the food tube and with all that, and didn't really pay attention to eating healthy. But now, thankfully, there's a new generation that is actually saying, hey, wait a minute, that's garbage, and I'm contaminating my body, and that can cause a lot of inflammation, cause a lot of disease. So it's absolutely the truth.
But in addition, nutritional value of the food that we're eating now just become much worse.
Absolutely.
Just recently was reading the article about published in a journal that the nutritional value for the past 40 years dropped 50%.
Wow.
Basically, this is even this food, it's whole food, but it's not nutritional value as was before.
Yeah, the soil's depleted, everything. It's terrible.
That's an excellent point, because you're absolutely right. Even the fruits and vegetables, the mineral content is down 30 to 40% of what it was 2 or 3 decades ago. So people think that they're eating good quality vegetables, and the soils are so depleted that we're not getting the nutrients we need.
Exactly.
I think one of the most overlooked sources of inflammation is unresolved psychological stress, that people are living with, and it's tough today. It's tough to make a living. It's when my parents bought their first house, it was $19,000. Today, the average house in our area is $300,000 or $400,000 or $500,000. I don't know how young people can do it, and it's really much tougher to make ends meet. So stress is a big factor here.
Absolutely, it is very, very true. So it's not only the psychological stressors, but the biological stressors, all with the polluted water and the food and bacterial infections. And so we're getting it from all different angles. So even if you don't think you have inflammation, you do, because just living in this environment, this part of the world, it's unfortunate that we have all these things. So it's so important. We feel very strongly, and that's why we're doing this webinar, that teaching people how they can try to minimize whatever they can control to minimize the assault on our bodies.
And getting back to the stress issue, 1 out of 3 people right now are coming to my practice for anxiety and depression.
Mm-hmm.
This is pretty serious.
Yes, it is.
Yeah.
It's the environment we live in today. There's so much pressure with, having to, succeed and, be the top of the game and all that. So it's very true. And then we see that the results because with all that stressors, Dr. G can tell you exactly. What do you see, Dr. G?
Yeah. I see in dental office a lot of people with stress and problems and anxiety disorder, but it's a lot of things adding up. And from our point of view, this is inflammation in the patient body, that caused by gum disease, inflammation in the bone, the toxic material in the teeth. A lot of things that we're really going to talk about, the oral health and the overall body-mouse connection. Because that the mouse, it's not something separate from you. And it's a lot of things going on. And we're going to talk about the bacteria that Dr. Gero mentioned, parasites in the mouse, viruses, mold, and toxic material, the real toxic, that we're going to talk about mercury filling, not biocompatible materials. And probably you never heard about dental galvanism. It's very, very interesting topic, and we'll talk about it. And we're going to talk about a dental infection really destroying you quietly, sitting there and just really doing a bad job against you. And that's why we're paying very, very careful attention to these small details. And we're going to go to those details a little bit later.
Yeah, it's amazing how here we just thought it was the food we were drinking and the air we were breathing and all that. There's so many things that can cause so many problems that we need to pay attention to. So, that's why I want to thank you both for taking the time to help our listeners, do this, because this means a lot to them. So we're going to move on. We're going to talk a little bit about, excuse me, that was me. I did that. We're going to talk a little bit about gum disease that you mentioned before, Dr. G. With gum disease and inflammation. Go ahead.
I remember that many years ago we talked about gum disease, you may lose your teeth. Later on we figured out that gum disease associated with diabetes, with high blood pressure, stroke, heart attack, low birth babies. But now we're talking about that it's increasing the cancer. It's not only head and neck cancer, it's kidney cancer, pancreatic cancer. Your chance with the gum disease increase to have a pancreatic cancer almost 50%. And this is a huge number.
Especially for men.
Especially today, I don't know too many people who survive pancreatic cancer.
Unfortunately.
This is very deadly cause. And the gum disease is really silent and people don't know. And majority of people come in our office and they're shocked. Then they just figure it out what kind of bacteria living underneath the gums. We can see bacteria, we can see parasites. This is a microscope, and we can see bacteria, we can see parasites. We cannot see viruses, unfortunately, but we really can see what we can help you with to understand what's going on. And then you know what's going on. And this is all these bacteria flying through your blood vessels and going all over your body and really badly affect your health. This is starting inflammation all over. And if you're thinking about that, I'm worried about only one tooth for you to lose. I'm worried your entire health. And I'm trying to straighten your problems to improve your health.
And that was Dr. Gero was talking about before, the microscope, how we take the swab of the bacteria. So most offices don't do that because we're looking for the cause of the inflammation. We get rid of the root cause, as Dr. Gero mentioned before. You want to find out what's the cause, then we can eliminate it. And that could be part of your healing process, without a doubt.
And the most important part, we're not going to put you on antibiotics. No way. We're going to put you on the supplements that are really going to take care of you and are really going to just improve your oral and overall condition.
That's true, right? Dr. Gero, he's smiling because he's the herbalist, the supplements. I mean, he's the guru. You go to his office and you got the wall full of supplements. I know because I'm taking a handful of them myself, and I have to thank him for it because I have to tell you, may be able to see my scar. If it wasn't for him, I would not have found out a problem I had that many doctors couldn't find. So yeah, so we're talking about supplements and herbs and be able to heal your body, assist your body in healing itself and ridding it of the inflammation. That's for sure. So yes. So we're going to move on to that. From that, we're going to talk about, all right, some of the ways that we can eliminate is not just the supplements and the herbs, also pH, right? Dr.
Yes.
G and us, and also Dr. Gero. It's both the mouth and the body.
Mentioned that we check in pH for our patients, but it's only saliva. Dr. Gero involved in this much more. I want you to talk about the pH.
Well, with virtually all of my patients, we're looking at the relationship of the acidity and alkalinity of not only the saliva, but also the urine as well. So I'm looking at first morning urine, and at the same time, we want them to do the pH of their salivas. So we're looking at the relationship of both. Now, if you look at the pH scale, it goes from 0 to 14. 7 would be neutral. So anything under 7 would be acidic. Anything over 7 would be alkaline. Now, many times, and people don't realize this, when you are running acidic at cellular acidity, the body has to do a number of different gymnastics to maintain homeostasis because the blood has to stay at 7.35, which is slightly alkaline, just to maintain your life. Because if the blood is not at 7.35, life cannot be sustained. So the body has to do a number of different physiological processes to maintain that, and the more it has to do, the more strain and more stress is put on the body. So we look at pH not only in terms of what people are eating, but what their stress is, because the more stressed we are, the more acidic we run.
That is very true. So, thank you. I appreciate that explanation. Now, we're going to talk about another thing that Dr. G mentioned earlier, silver fillings. They contain about 50% of mercury. So, yeah, it's a filling. What's that got to do with inflammation? Now, Dr. G, I'm going to ask you to please explain that.
Silver fillings, in reality, it's not a silver. 50% of mercury. It's supposed to be called mercury fillings. But who want to put in your mouth mercury fillings? If somebody could tell it's mercury fillings, people just tell no, no, no.
Right.
But in reality, it's 50% of mercury. And it doesn't matter what, that somebody may say it's stable, it's cheap, it doesn't break too fast, but it's a toxic material. It's a mercury, very, very toxic material. And the most interesting thing that the second we're drilling out this filling from your mouth, it's become biological waste. It's a really toxic waste. And we have to put a special device to just protect the environment from this toxic waste. Just imagine yourself, in your mouth it's okay, outside of your mouth it's toxic waste. That's why you see in front of you it's a mercury separator, and it become mandatory in state of New Jersey from 2009, installed in every dental office. It's a big problem because we're drilling a lot of silver fillings. And if you look at this picture, look at this, how patients prepare to remove the silver fillings from his mouth. It's a big preparation. It's really need to be protection. And it's not only mechanical protection. It's not only physical barriers. It's only a lot of supplements that we put in patient in. And every time the patient in, we're talking about how to protect your body to keep it health and just keep it just better health than it was before.
Exactly. And I know, you'll tell the patients a lot that with the mercury, that can actually cause inflammation in the body and inflammation in the brain and all that thing. That's why, some people can react to it. Some people don't. And that's why some people say, oh, mercury's fine. It doesn't bother me. Well, for you, it's okay, but for somebody else, it's not. And it can cause a lot of problems, right, Dr. G?
But everybody can relate to it, because if something okay with the peanut butter, somebody can die from this.
Right.
It's the
Like
same with the mercury feeling.
I love peanut butter. I can eat it right out of the jar. I love it. My son, forget it. The tiniest, forget it. He's dead. You know, so it's everybody's different, right?
Yeah, and very often what I do, I ask every patient that when we remove the cellular fillings, how do you feel? Week later, 2 weeks later, and the story that they tell me, it's amazing. You know, I'm never going to forget the patient who said, you know, that now after I remove my cellular filling, I can read and remember 2 pages.
Wow.
You know, this is a huge. If person can remember 2 pages that she read, it's huge, because you know that she had a mental fog. And this is a lot. Somebody can handle, somebody cannot. But I don't want anybody to handle this toxicity. It does not matter who you are, how strong your immune system, why to overburden your immune system.
Exactly. Yeah, and I'm sure you must agree, Dr. Gero.
Absolutely.
Yeah.
You know, I see a number of people that have toxic metals in their system, and not just mercury. One of the things that I perform in my practice is a hair mineral analysis. We clip a little bit of hair, we send it to a laboratory, and we get a 16-page report. We're looking at 8 different toxic metals like aluminum, lead, cadmium, mercury, beryllium, arsenic, uranium,
A lot.
and it's and many times when people are presenting with a number of physiological problems, we can actually tie into what specific heavy metal is contributing to those physical and psychological problems.
Right.
Yeah.
That's why you do the chelation, you know. You have to try to get, if your body's not eliminating it, you have to assist it in eliminating, and that's where you would come in. That's why the 2 of you together, you're like this perfect synergy that, one hand.
You need to be remove mercury fillings before you're going to do chelation, because
Exactly.
Counter process, that you just removing something getting in, removing something getting in. It doesn't work this way.
Right.
The filling needs to be removed, and after that, detoxification needs to be done right.
2 pieces of the puzzle to get the patient healthy.
We're actually the dream team.
There you go. I love it. That is very true. So yeah, so we do the chelation with the mercury, and then we're talking also about other materials that can cause problems in the body. Right, Dr. G?
Oh, yes. Because it's very important for us not only remove mercury fillings, but to something that works for you. You don't want to put anything that's just going to work against you. You don't want any allergic reaction, any metals just going to leak in your body. And we really want to check it out, and we have a certain tests to do it. And this is interesting picture. I see dozens of patients almost every day coming with a different metal in their mouth. And what has happened? This is 3 different metals in the mouth and going to create a better effect. And the amount of electricity running between those 3 teeth is just big. Just imagine yourself, your brain operates on electrical impulses too. And this is much bigger power than in your brain. No. And I have a patient who coming in and they tell me that I cannot be next to the cell phone. I cannot be next to the computer. I cannot be next to the TV set. And I just really cannot understand until we measure it, remove all these metals, remove electrical conductivity and electrical current in the mouth, and they just feel themselves different.
Wow. I can see Dr. Gero wants to say something. Go ahead.
No, I agree. And it's amazing. I had somebody that was in my office today, and we went over his hair mineral analysis. He had the highest level of arsenic I've ever seen.
Wow.
And I don't know if it was occupational or it was something that he was
chicken and rice.
But it was 30 times higher than what would be a safe level or a asymptomatic level, but 30 times higher. And the only thing that was saving him is the fact that he was relatively healthy with a number of supplements that he was taking. But if it wasn't for that, I'm not sure if he would be with us today, because arsenic is a very, very dangerous substance. So yeah, I mean, there's
And that goes back to, the pollution, the air and the food and supply. I mean, from what I understand, I mean, I don't know everything, but as far as with the arsenic, you can have contaminated the rice and the chicken and all that. You get a lot from that.
Yeah,
So a lot of the foods and the water that you're getting.
The problem we all have is we all live on planet Earth. And no matter how careful we are,
right,
we have the exposures because we've essentially destroyed the planet. And eating impure foods and the air we breathe and the water we drink, and we just have to do the best we possibly can. But being aware of what we've got in our system, because there's a lot of people that just don't want to know.
That is very true.
Ignorance is stupidity.
Yeah,
and that's why what we are doing to enlighten people as to where the problems are, we can do something about it. If they don't know, they're living blind.
Right. Well, I have to say, I mean, correct me if I'm wrong, I do find it, I'm going to give you a little quick example on this. My father, loved him to death. I would go visit him, and I'd say, Dad, what happened? I went to see the doctor. And I said, oh, that's great. What happened? He goes, oh, he gave me a prescription. I go, for what? He goes, I don't know. He goes, what did he tell you was wrong? I'm like, I don't know. And I said, did you fill the prescription? Well, and he goes, yeah, I filled the prescription. And you're taking it? Yeah, taking it. I said, you don't know what he goes? Yeah. I said, why are you doing that? He goes, well, the doctor told me to. And that's true. And I'm like, Dad, don't you ask? Don't you mean to know why and the how and the who and all that stuff? See, that's why I'm glad that we're having this there's like a movement, this enlightenment movement where people are asking more questions. They want to know more, and that's why we're doing these webinars to give them the information that the people that are really saying, "Hey, wait a minute, doesn't sound right. Let me find out more." So I really, again, it's great that we're able to do this to help them. So we're going to move on because I want to make sure we get all the information, and so next we're going to talk a little bit about infections of the jaw. You can see here we have an infected tooth. So Dr. G.
It's a big topic, and this is very important and very, very complicated topic. And the patient coming in, and they look in my eyes and ask you what to do with the root canal. And tooth like this, I look at this and tell, just remove it. That, oh, it's tooth, I want to just keep it. And I understand, but this tooth is destroying your life. And I start asking the questions, and I asking the right questions. And my question is just really, really specific because unfortunately, a tooth, it doesn't stay on the shelf. It's attached to our body. And the tooth attached to our body and inflammation around the body affects certain organs. Just imagine yourself acupuncturist. You put in a needle in a specific area and it's treating your stomach or the pain in a specific area. Just every tooth affects a specific area. If you look in every tooth, I know by heart what tooth affects what area. And then I see the tooth at least, I ask you, how does digestion work? Do you have any problem with your lungs? And the last time you just had a cough. And how do you have any problem with your urinary system? It's unbelievable. This was found out more than 5,000 years ago, described by Chinese. It's not a secret, that every educated person can find a meridian chart on the internet and look at this.
Right. And you would think it's only a tooth. Say, what's my tooth? Got to do with something else. But it's attached to your body.
Yeah.
People don't realize.
Yeah. I just removed recently the tooth of the patient, and she was here in the office today. I asked her, how do you feel? She looked at me, what do you mean? I tell you, how do you feel? She said, I don't know, but my pain in my shoulder that I had for the past 3 years, gone. She went to chiropractor, she went to acupuncturist, but she did not know that this specific tooth affected, muscles, joints, internal organs, and this needs to be removed for her own health. Unfortunately, we cannot save everything, and sometimes we have to lose it.
Yeah, and then sometimes people question, oh, that's a bunch of hooey, but acupuncture, it's the same. That's what it is. It's the energy pathway. So people go to acupuncturists for pain, right? So this is the same pathway. So
this is very interesting story about how acupuncture came in the United States, well known, because it was pain involved.
Is that what it,
You know that it was, if we have time, I'll tell you a story. If not, another time.
uh,
Okay?
well, you know what? Maybe you're going to hold that thought for the next webinar,
All right.
which we're going to be holding next month, which we're actually doing a special because we normally were going to do one in April, but we're doing one a little sooner because we've had so much buzz actually on the meridian chart that we're going to throw that one in. Can you save that thought? So all you
Okay.
people listening now, make sure you pay attention to when we're going to have the discussion on meridian chart. So hold that thought. But it's true. A lot of people don't realize that, the mouth is connected to the body. It was a complete disconnect years ago, but now we are all realizing how much of a correlation. A lot of things, inflammation and infections in the mouth are causing or exacerbating problems in the body. And I'm sure Dr. Gero sees a lot of it. People are coming with systemic problems, and, he's saying, okay, I think you need to see your dentist, as part of their treatment.
Absolutely.
And then we are seeing people with dental issues that say, you need to see your naturopath to make it that thing. So working synergistically, right?
Like I said, the dream team.
There you go. That's very true. So, we're going to talk also about dental ozone. Dr. G, you want to talk a little bit about?
It's wide used in our office. We're using it as a water. We just ozonate our water that we use it for everything. Even the water you rinse in your mouth, used for the dental cleaning, we ozonate it. We use ozone as a gas to just kill parasites and bacteria underneath of your gums. We're using the ozone to improve the blood flow and healing ability of your teeth. And we're using ozone even before the placing the implant, after removal of toxic teeth. We're using ozone a lot. Ozone is unbelievable modality, and if you know how to use it right, it's just really helpful.
Right.
And
The whole thing
always
is
using ozone when we're removing toxic tooth. Definitely need to be just ozonated, fumigated, just remove and clean it up.
right, because if you, like you and Dr. Gero were saying earlier, if you have infections and parasites, bacteria, and all that, that can cause inflammation. So you need to hit everything from every angle,
Yeah.
So using ozone is another piece of the puzzle of being able to reduce infections, inflammation in the body, so that way you can, get to that level of health that you want to be at. Now, I just want to let everybody know, I'm not ignoring you. I do see some questions in the chat, and I'm definitely going to get to that. But like I said, I want to get all the information in, and then we're going to be happy to answer your questions. So don't think I don't see those questions. I'm looking right at it. So I'm going to get to you as soon as these two doctors are done. All right. I just want to make sure I got that in there. So we're going to move on just a little bit more because we're getting a little tight on time. So we're going to talk now a little bit about the PRF. What is that, Dr. G? Can you explain what that means?
It's a part of your blood. When we remove infected tooth and we want to promote healing, we just draw a little bit blood from your vein, and we spin it in a special machine. It's a platelet-rich fibrine. And what it does, it just really excites your body to heal and produce new bone. Because I just have just few days ago a patient who just came here telling, I'm looking for the doctor who not gonna just pull my tooth and put something from the cow or from the dead person. I totally understand him.
Right.
Because the time that we used to put the bone graft material from the box in our office basically gone. We're using the good material they get from your own blood, concentrated material. It does not come in from anybody else. It cannot be, any allergic reaction. It's always integrate and help you heal.
Well, that's it. Because no allergic reaction, because we have allergies, or if you have a reaction to, another substance in a foreign body, that's all going to create inflammation. So here, you can't get any more holistic than that you're actually using your own body to enhance its own healing.
To rebuild it.
So it just, that reduces inflammation tremendously. So you get rid of the infection, reduce the inflammation. You use the ozone to reduce it even more. You use your body's own healing properties by using the PRF. You're reducing inflammation even more. And then using Dr. Gero's wonderful skills as a herbologist, supplement, and nutrition and all that. So all together, you definitely, like you said, dream team, getting everybody healthy. It's fantastic. So next thing we're going to just discuss is that there are two prominent doctors. So Dr. G, can you talk about Dr. Rao and Paracelsus Clinic and Dr. Klinkar?
Dr. Rao from Paracelsus Clinic, it's a clinic in Switzerland that just specializes on treating the difficult cases of autoimmune conditions and cancers, and they're very, very successful. And he said, in their experience, no one can overcome the health problem without biological dentistry. And they know about it, because if you look at the Paracelsus Clinic itself, it's a medical module, dental module, and they have their own place that the people going to eat. They don't want anything from outside. We'll just come in here unless the food is really, really clean and prepared properly. And they want to just remove the old dental infection before they're going to just go into the treatment, because they know how it's correlates. And another statement was from another prominent physician. Can you show that back? Frank?
Absolutely, doctor.
Yeah. This is Dietrich Klinkar. 80% of patient health problems can be partially traced in the mouth. And this is absolute truth. You know that I see so many problems in the mouth, and if you read about this prominent physician that getting a great result, they saying that you cannot just ignore the mouth problems. You can't ignore infections, you can't ignore the gum disease, you can't ignore the silver fillings, and this is very, very important area of their expertise that are really looking at the patient mouth. You know that physician who really just ask patient to open the mouth and counted the amount of silver filling and ask how many root canals do you have. It's unbelievable in my mind.
Yeah, you should see the intake form that Dr. Gero has. It's like gone with the wind. It's so thick, but he turns you inside and out. So he wants to know every detail of it, every aspect of your life. So you have your own little mini Paracelsus clinic going on right here between the two of you. But it's true. But I'm just going to make a little comment to that when you're talking about with the dental and the medical. It's a true story, if you don't mind me sharing. Quite a few years ago, there was someone I knew who was telling me a story about a patient who was in the hospital, and he was very, very sick. He had sepsis, which is a blood infection. And they were doing everything they could find to make him well, giving him strong antibiotics and this and that. And he was failing. He was not doing well at all. And after a couple of days of multiple testing, one of the residents got smart enough and looked in the patient's mouth. The patient had such severe advanced periodontal disease that they actually tested it, and that's what was causing it. Thankfully, the hospital was also affiliated with the dental school that was attached. They were able to remove the teeth, remove the infections, and that's what helped the patient. So a lot of times people don't see the correlation. Both these doctors see it all the time, and they're helping patients get well who don't realize that there's that correlation. So you both bring it to light. So that we have to definitely thank you for, without a doubt. Because I have to say, like you said, you're the dream team, but the dental and the medical practitioners are working synergistically to improve your health every day. So just getting a tooth pulled and I'm going to say, it's not just a cleaning. A cleaning, we're just diagnosing a disease. If you have disease of the gums, how it can affect your heart and your lungs and your kidneys and all that, as Dr. G was saying earlier. He's a physician of the mouth, and Dr. Gero, he sees the problems where people come in and they have malaise, they don't feel well, they just have this overall not feeling well at all. And so, the two together really help our patients get well. So at this point, I'm going to have both doctors say one last thing, but I'm going to get to the chat because we're almost out of time. So I'm going to find out some of these questions. We have here, one question here, should root canals be removed? And if so, is that a big job?
No, root canal removal, it's not a big job. It just needs to be done right. Just remove the tooth. You need to clean infection around. Very important. And make sure you're not going to reinfect it again. This is important. Just remove the root canal tooth It's not a big job. It needs to be done right.
Well, that's it. And this is what we do all day long. So we're pretty equipped to do that. And if you ever need any other issues, Dr. Gero can step in and help you with that too. We also have another question. So it sounds like there's a million causes of inflammation, so we can't prevent it. So what would your suggestions be? I'm going to ask both Dr. Gero and Dr. G. What would be some of the tips that they can recommend to our listeners of what they can do, like simple things they can do, and then maybe even some more advanced things.
What does it mean you cannot protect it? From my point of view, everything in the mouth very easy to see. I can find out do you have a gum disease or not in 5 minutes. That in reality it's a little bit longer because the hygienist is going to measure your gums. They're going to have a dental X-ray. They're going to check everything else. But in reality, they're coming for examination. That after hygienist got all the information, I really can tell you, do you have a gum disease or not? And this, you see on the computer screen, that bacteria and parasites floating around your gums, that you have a problem. Do you have a silver fillings in your mouth or not? It's very easy. You open your mouth and look in the mirror. This is what you know. That when we're taking dental X-ray, we know the root canals. And we know if the teeth are infected. And you cannot chew on one side of your mouth. You definitely know that you have a dental problem. It's very easy to figure it out.
And then Dr. Gero, on your end, on the more medical end, what would your recommendations be?
Well, I'm looking at a lot of physiological signs. I'm doing hair mineral analysis. I'm really trained to interpret blood chemistry, and I'm looking at not only the values of each one of the blood chemistries, but I'm looking at the relationship of each one of the values to each other. But essentially, there's a number of blood tests that I look for that are signs of inflammation. For example, elevations in C-reactive protein, cardio C-reactive protein, which is very specific to the cardiovascular system. Platelet levels over 300, even though that's within the clinical range, but anything over 300 is a mark of inflammation. And medical doctors don't understand this. Fasting insulin levels that are elevated, elevations in hemoglobin A1C, which is a benchmark of blood sugar dysregulation, elevations in serum ferritin levels, red blood cell width, the width of your red blood cell, the erythrocyte sedimentation rate, the rheumatoid factor.
Okay, I don't mean to, doctor, but that you just put up something, because I have another question that's going to pertain to that, because it sounds like you turn people inside and out with all that list of things.
Oh, I have
amazing.
To. I have to.
Exactly, and I know because I've been to your office, so I know exactly how that goes. So we do have a patient that says that she has lupus. What can she do?
Well, I treat people. Now, this is a patient that has lupus. Now, instead of treating the lupus, and I have a lot of people with autoimmune conditions. So what I want to be able to find out is what are the causal factors that may have contributed to some of the degeneration. And lupus is basically a connective tissue disorder. So we want to be able to not only restore some of the connective tissue issues, but also try to uncover what are some of the risk factors that actually were precipitated that may have been causal. We can't cure lupus, but we can render somebody relatively asymptomatic. So they may have it, but if you don't really express some of the symptoms associated with it, you can live your life and feel good about it.
That is true. So, and that's something that you can definitely do. Now, I have another question for you, Dr. G. It says here, what kind of material do you use for fillings that is holistic?
Our material, anything that we use in our office, it should be fluoride-free, BPA-free. To really check all these chemicals what are involved in those materials. Preferably, we prefer porcelain or zirconia, which is the best material. But if it's small filling need to be done, we wanted the best possible material. Also, we use a special test to find out what materials are good for you, what is not for you, what might be allergic to. If a patient need to perform this test, we can draw the blood and send to a special lab.
Right. It's like a sensitivity test because people
Yes.
can be reactive. People don't realize that they can actually be reactive or allergic to dental
anything.
materials. Well, you can be allergic to food and environment and, you know, things, and you can be allergic to dental materials, and it's like a disconnect there. So we can actually check that to make sure only safe materials are going into a patient's mouth. So,
Yeah.
and that's one thing we can definitely say for sure. We are not using mercury fillings, that is for sure. That I can guarantee you. I have one more question for you, Dr. G, if you don't mind.
Sure.
The root canal question that we had earlier, she's saying, when you say remove the root canal tooth, do you mean to pull the tooth? And when you say remove the root canal tooth, do you mean to pull it? So that's actually a repetitive question.
You know that you may say it, pull the tooth. I tell the remove the tooth because it's a cause of the infection. I need to remove the cause of the infection. For me, this is the right thing to do to protect your health. Because, you know, nobody forcing patient to do anything. We just always educate you. We just always talking to you. We just giving you possible outcomes. And we're really just trying to just talk to you as a friend. Because if I'm in my mind, and you know it's in your mind too, this tooth causing you the problem, you know that unfortunately we have to lose this tooth. You know, nobody talking about infected appendix to keep it. You know that it needs to be removed. You want to live, you have to remove infected appendix. You know that I don't know what's the problem with removing the infected tooth and really destroying your life. In today's technology, we can substitute this tooth. It's quite easy. It's predictable. It's like, you know, we know what to do. If it does not cause any problem and your immune system is strong and you're relatively young and, you know, you're strong, I'm not going to talk to you about removal of the root canal teeth. Never. Unless you really ask this question. Because if I see infection, if I see the correlation between your health and the tooth, I will definitely talk to you. Because you are my priority. And your health is much more important to me than just one tooth to destroy your health.
That is very true. Thank you, Dr. G, for that very thorough explanation. So I'm going to ask both doctors, we're running really short on time, so I'm going to ask Dr. Gero, your last statement on inflammation and what people can do at home, or what they, you know, what your recommendations would be.
Well, there's a number of things from a lifestyle perspective that we have to keep in mind. And I just indicated a couple things, like make sure you're eating the right foods, that the foods that you're eating, even though you think you're eating a healthy diet, what are the foods that are actually affecting you? Make sure that you're always thinking about detoxification, because we're all loaded with toxins, and eliminate the pro-inflammatory foods that you're consuming. You want to be more resilient. Look at what are the aspects that are going to reduce your stress. Exercise. Don't exercise too much. Certainly, you've got to move. And stop poisoning yourself. People are poisoned with all kinds of medications, polypharmacy. People are on 5, 6, 7, 8, 10 different medications. They're killing themselves. There's nothing worse than medical doctors who are giving their patients 20 different medications. Rest and sleep, nutritional supplementation, but the appropriate nutritional supplementation, things like fish oil, probiotics, curcumin, which is the turmeric, bromelain, MSM, all of these, they're anti-inflammatory, but make sure you know exactly what you're taking and for the right reason.
Right, and
that's
if you
why,
need it,
exactly.
You know, just take things arbitrarily because, my friend's taking it. I'm going to take 20 because it's supposed to be good for you.
And that's why I do the testing. And I also agree with looking at what is appropriate for the individual, and not just giving somebody, otherwise you're just going to go to the health food store and listening to the individual behind the counter. But to understand what you need, what is appropriate based on all of the testing that we do. And I love the fact that we have the same ideology.
Right. I mean, like Dr. G and both you, Dr. Gero and Dr. G, it's that we design treatment for the specific needs of the patient. It's not just, across the board, everybody gets the same thing. You design your treatment towards their needs. And That's what's great. And Dr. G, I'm going to ask for your last statement because we're going to have to wrap it up real soon. So go ahead.
All right. I just, my statement, just take care of yourself, because you have only one body in this life and you really have to take care of it. And think about the food as a medicine. You know, just, it's a lot of opportunities for us, and you may juice in the morning. It's a great thing to do for yourself. You know, just protect your body, be healthy, and enjoy your life.
See, nice sentiment to end with that. So we're going to start wrapping it up. We want to thank you for staying with us this hour. We hope that you've learned something. Hopefully we've answered some questions and gave you a little food for thought, so that you can start thinking about maybe I need to start doing something about how I feel. Now is the time to get your pen and paper, because we're going to put up a little bit of an offer for those who think they might want to start making a difference in their life. We're going to talk about if you want to come in for a holistic cleaning, which includes that slide that Dr. G was talking about. We use ozonated water and herbal solutions and fluoride-free paste. We do low-dose radiation x-rays, and we do a full comprehensive exam, all for only $99. So, for the webinar special, we can offer you $99. It's normally $445. You can come in and you can have gum disease? Do I have inflammation? Do I have any problems with any of my fillings? Do I have an allergic reaction to any of my fillings in my mouth, or crowns or caps that you might have? So this is a good way it's a start. It's a new year, new beginning. And for those of you that have also stayed on this long, if you call, you're going to also get a ebook on fighting inflammation from Dr. G and Dr. Gero, the dream team. They're putting together this great, oh my gosh, I lost you guys. You're putting together this great, there you are, I lost you for a minute. This great book on fighting inflammation. So if you give us a call at 973-6114, you can make your appointment for your $99 special. Also, anybody who's now been on the webinar, you'll also get the book, but call 973-6114. And for those of you who want to get a hold of Dr. Gero, you can contact us, or you can give him a call at 973-471-5758. He's right there in Clifton.
You forgot zip code.
Okay. And we're here in Milburn, New Jersey, and for those of you who don't know, and we want to thank you again. We're going to see you in a few weeks. Look out for our next webinar. We're putting in a special one on the meridian chart. We've got lots of questions about it. And thank you, all of you on Facebook Live. We are so happy that you're able to join us. And we want to thank you and have a great night.
Thank you.